told, there we go. Oh my goodness gracious. Hello, everyone. It is lovely to be here. This is the largest room of all time. I'm loving it. Okay, my name's Jared. I'm the founder of an organization called $4. How many have heard? Yeah, oh my gosh, this is ridiculous. How many of you know what charity care is? How many of you have heard me talk about charity care before? Perfect. This is all just going to be fun reminders, people. So I'm gonna get into a little bit. Okay, wait. The path to charity care is what we're talking about, people. Let's go. Okay. First, I want to give a little background. You all know this, but here we are. Charity care, if you don't know, is a federal law that requires nonprofit hospitals to discount or even waive completely your hospital bills if you meet certain income requirement. How many of you, this is new information? Okay, lovely. I love that. Honestly, I say this all the time. People still don't know what this is and that this is a possibility for them. So we have millions and millions of people that are declaring bankruptcy or going on payment plans for bills that they do not have to pay. That is a problem. So we try to make that easy. I started this organization originally as a crowdfunding platform to help people pay medical bills. I did that for years after watching my own family go through a medical emergency and realizing that when you have a medical crisis, a lot of times you have a financial crisis, and I wanted to help people through that. Then I found out about charity care. So I spent years paying people's medical bills that all would have been eligible for free or reduced care, and I just didn't know about it. So I switched strategies, trying to figure out how do we get the word out about charity care and how do we make this easier for patients? Because I started finding patients that had large medical bills that were eligible, but the process was really difficult. And when I say really difficult, I mean like they'll mail you a packet in 7 to 10 business days, and then you can fill it out and fax it back to them and all that. So big problem. And before I get into it, I want to just also say, like, this is why we exist, and I feel like I skip over this part. Like, why is this so important? Why is this so important, and why is charity care so important? It's because we have 188 million Americans that are living right on the edge of poverty, and medical debt is the number one thing that pushes people over that edge. That is an enormous problem, and we have something that already exists in charity care that could be a huge solve for a lot of people, and they just have no idea. Hospitals aren't telling people about it. They make it extremely difficult. So what $4 does is that we try to make this easier. We have created a database of every hospital in the country, all of their charity care policy data, so that we know who is eligible, and patients can put in their household size, their income, what hospital, and it will tell them what they're eligible for according to their own hospital. And then we help them apply. It's kind of weird because this is like my third time speaking at this conference, and we have changed so much as an organization since the first time I spoke. Because the first time I spoke at $4 or at Healthcare Advocate Summit I was the only person at $4. And now we have a whole team of patient advocates, and we have eliminated almost $60 million in medical debt for people throughout the country. Thanks. Thanks, everybody. So we have, and I'll just give a little bit more background on our platform so people can see if they're eligible for charity care. And then we took it a step further, and we tried to make the application process easier. So every hospital is going to have their own policy, their own application. And usually, they're just going to mail it to you and require you to fax it back or mail it back. We have gone through all of the applications, and we have mapped them so that you can fill out the application on your phone, tablet, computer, and it will automatically fill out the right hospital application, and then we send it to the hospital, which is great. It makes it a lot easier, and which is why we've been able to help so many people. So this is like what we've done, 58. That is out of date, people. That is 58 million. We're closing on, actually, by the end of today, we might be at 59, which is great. And we filled out over 17,000 applications for people. So we know what charity care looks like. We know what the applications and the policies say, but then we also kind of we know what it looks like in action because we are advocating for patients. So that is a little bit about $4. And now I want to talk to you about what we got into this year. Charity care is difficult. We know that. And the big question we wanted to answer this year was, 58 million is great. That is something to like celebrate, and we're pumped about it. But how do we solve the actual problem? And how big is the problem? How much charity care is being missed every year at hospitals? Which is a really annoying project to take on because a lot of hospitals don't report it. So has anyone like really got into hospital 990s and like looked through some of the, yeah, okay, I love it. I love it. There's something called a Schedule H that hospitals have to fill out. One of the questions on that application, or on the 990, is how much bad debt is at this hospital? And what that means is how many people did you send to collections for the most part? And they'll put a number there. And then the next question is, out of that bad debt, out of the people that you sent to collections, how many of those people were eligible for charity care? Which is a great question. So it's kind of like the hospital is admitting, like, this is how many people we missed, right? And sometimes it's left blank. Sometimes it's a 0, which is incorrect. And then sometimes you'll get a number out of it. So we scraped through a lot of these, and this is like the first big project that we did. How much charity care is being missed? And this is a extremely, extremely conservative number because, again, a lot of these hospitals are not reporting this. So we had to look at 990s from a bunch of different hospitals, and luckily Maryland, the state of Maryland has some other data that was available that other states don't have. But very, very low estimate. Every year, hospitals are missing about $14 billion of charity care that should be given out to low-income patients. That is an enormous problem, and 58 million is great, but like, what the F are we doing here, right? Like $14 billion, how many? Like I posted something on our social media, and it was like, I don't know, it was kind of bragging about like, oh, we just hit 58 million or whatever, and somebody was like, hey, I love your organization, but this isn't really that impressive because like it would take you 3,000 years or whatever to actually solve the problem. So I'm like, thanks, dude. That's awesome. I freaking know that. So what are we trying to do here? And so after we find this number, then the big question was like, well, why? Why and how are hospitals missing this amount? Which brings us to our next lovely project, which was, why is this so difficult? And we already have some ideas because we do this a lot. But we wanted to really, really like get into it and talk to patients that have gone through this process and figure out like what were the pain points for you, and how could it have been better, and what are the things that like made it really difficult? Because 14 billion is ridiculous. And again, that's a low estimate. So, and really we're trying to figure out, okay, we can be this organization, this like small organization that helps individuals that happen to find us online, or a referral, which by the way, anybody can refer patients to $4. If you work for an organization or are a patient advocate, which I'm assuming a lot of you are, you can use these resources. You can send patients to us if you think they're eligible for charity care. But we're not going to get to 14 billion that way. So how do we do it? Which was kind of the reason that we did this whole project. So we wanted to talk to patients. We wanted to really dig into it. Like, why is this so difficult? And we found that only 29% of patients are even able to apply and receive charity care. Not great. So that's kind of like the first big thing that stood out. Okay, well, and we kind of already knew that, and I'm sure that none of actually, does this number shock anyone? No. Yeah. If anything, you're like, oh, wow, that's pretty good. because we know the process, because we know how difficult it is, right? So a couple things about, we as an organization have said, our mission is to make charity care known, easy, and fair. And everything that we do kind of falls under these buckets. Are we making charity care known? That's why we do the social media stuff. That's why we partner with all of these organizations. It's like we want to get the word out there so that people know about it. And the frustrating thing is that more often than not, patients are leaving the hospitals with an enormous bill that they can't pay, and then nobody's ever told them about charity care. So people are finding $4 like 1 to 3 months after they get a bill. And what we're trying to do is move that upstream so that when a patient is eligible for charity care, they don't even get a bill. That would be the ideal. So yes, 51% of those who are potentially eligible don't apply for financial assistance. A lot of people, most patients just aren't getting information. And the other thing about that is that even if they are getting information, a lot of that looks like small print on the back of a bill, right? Like we've all seen this, where it's like even the ways that they are trying to tell people about charity care, like that's not it. Having a sign in your, a poster in your ER is not helpful. That this is not how people are going to be able to apply for charity care. And if you look at the actual law, it says that charity care has to be, what is the exact wording? Christy, Erica? It is like, it has to be publicized in a certain way, or it has to be widely publicized and widely available. Those are the two things. Widely publicized, widely available. There aren't really any solid things that people have put in this is what widely publicized means. So it's like, well, okay, well, how about a poster in the ER? That's great. It doesn't work. So again, number one, why is there this $14 billion gap? It's because people don't know about it. People still don't know what charity care is, and it's a big problem. Second thing, which I've kind of talked about this already. It's not easy. How many have filled out actual financial assistance applications for patients? How annoying is that, right? It's like, what is going on here? We have seen the craziest things. And I love, it's like a love-hate, talking about well, what's the craziest question that you all have seen on an application or whatever? These hospitals will ask questions that don't make any sense. It might be, well, what is the make and model of your car? How much is your car worth? How much do you have in your retirement fund? How much livestock do you currently own? It's really difficult. And only 12% receive help in the application process. So again, there are some hospitals, there was one in Oregon actually, that said, we spend over $8,000 every month just on postage, just mailing out applications to almost all the patients that we get. So they're just getting an application in the mail with no explanation of what it is, why they're getting it, or anything. So then the patient gets that, and it's like, okay, well, now I'm going to have to print off my 30 pages of proof of income and then mail it back or fax it back to the hospital. A lot of patients they just need an advocate. They just need someone to like walk them through even simple things like, what is a household size? What is it, like what are the things that you can leave out in this application? What are the things that you have to have? Because really, all the hospitals need to know is how many people live in your house and how much money do you make. That's pretty much it. And they throw in a lot of other questions in there that they don't need to. And it's a little intimidating. So charity care is not easy. I mentioned this before, hospitals using fax, mail, as like the primary way of receiving this information. And then we see that working with organizations like $4 boosts approval rates to 67%. So still, not the greatest, but in talking to that hospital in Oregon, they said that they receive less than 1% of those applications back. So mail is not working, people. End of presentation. Just kidding. We all knew that. Okay, so charity care is not fair. Again, known, easy, fair. There are certain things about this, like the most common reasons applications are denied are because of age of the bill. So a lot of you already know this. 240 days is kind of the magic number for how long you have to apply. So one of the most common reasons people are being denied is because they waited too long. But they only waited too long because they didn't freaking know about it because nobody told them about it, right? So all of these other issues that come in with like, well, this just doesn't add up. Like, you shouldn't be denying patients charity care for, an expired timeline for something that they didn't even know about, which is what we're seeing all the time. And then the biggest thing that we are hearing from hospitals is like the administrative burden. Like, oh, we got to go back and forth with these patients, and it's such a pain, and they never respond to our letters, and it's like, well, yeah, no duh. And it is like, it's a tough thing because $4 gets to kind of sit in this space as like a good guy. Like there's big trust issues with hospitals, and a lot of patients leave and like, I'm not giving them my information. I'm not going to give them my tax return, my pay stubs, and all of this stuff because they don't trust the hospital, which is a huge issue. So it sucks that $4 has to exist at all, but that's one of the main reasons, is people just don't trust the system. So then when they hear about $4, they're like, great, I'll work with this nonprofit because they're not going to send me to collections or try and steal my house or whatever. And there's a huge education piece as well of patients just being in fear of, I'm not going to give them my income because then they're going to be able to take something from me or something. A lot of times patients think that if they send that information in, the hospital has some like right to, access their accounts or something like that, which is just not the case. Patients are denied charity care. They're forced into payment plans, sent to collections, obviously. There's also huge racial inequities in this space. Like we see Black patients are denied charity care at higher rates. And then we have the whole like language barriers as well. And a lot of hospitals, again, are required to have their applications and their policies in different languages. But it's hard to find, in their whole website, it's like the policy and the application exist in these different languages, but the entirety of their website is not available in those languages. So it's like, well, how are they going to navigate to the place that they need to find the application in their language when the rest of the website isn't translated? So, huge issues on like the fair, and I could go on, and I continue to think of things, and I need to wrap it up. The other thing is, when people get charity care, it makes their lives better. They are able to pay off other debt. They're able to save. They're able to buy a home, buy a car. And we've kind of been in this space of, as a nonprofit, we're trying to raise money to fund our program because we're free to patients. But when we go to donors, it's like we're crushing medical bills. And if you know anything about philanthropy, there is no bucket for crushing medical bills. It's like, what are you? What are you raising money for? The environment, economic opportunity, like these different things. And charity care and crushing medical bills doesn't really fit into that. It's economic opportunity. It's when you get this, when you are able to eliminate medical bills, people's lives change for the better. So how is $4 trying to improve this? I'm going to try and wrap up so that we can have time for questions if there are questions. This is a big shift for us because when we answered that question of the 14 billion, it was kind of tough because it's like, well, we're not going to be able to do that. We're not going to be able to solve this problem or even make a dent doing it how we're currently doing this with referrals and social media and people finding us, on Google if they happen to search. So how do we get ahead of it? And we're trying to work directly with hospital systems. Hospital systems are constantly complaining about the administrative burden of charity care. Patients don't trust us, they don't fill out the paperwork, all of our technology is old. We are starting to go in and say, hey, just let us do it. Instead of, if a patient calls you and says, I can't pay my bill, I need help, how do I apply for charity care? Instead of sending them a packet in the mail, they can say, we work with $4, go there. So that's one way, because we need to get to the source. It's like, how do we get patients to come to us in larger volumes? It's not going to be through TikTok, unfortunately. So we also we're getting contacted a lot by state and federal agencies that are saying, hey, we're trying to pass this law. What do you think? Like, you're the charity care expert. So Oregon, North Carolina, all that, which is great. I think that there is a place for policy work that we can step into, but that's I don't know anything about that. Trying to figure out how to do more policy work is another, and honestly, even today, the CFPB put out a big report, and they cited both of our reports that we put out. People go to us and say, okay, what's the deal with charity care? Can you help us with this? So we're working to improve the charity care and actually solve this $14 billion problem. But pretty much, you need to remove the burden from the patient. Right now, it is on the patient to find out about charity care, to figure out how to fill out the application, do all of these things, and then it might not even be approved because of something that was outside of their control. So right now, our big thing is trying to push that burden on the hospital. It shouldn't be on the patient to find out about charity care, to fill out all the applications, to do all that stuff. It should be on the hospital to tell them and lead them through that. So that is kind of our big stance on it. And I think, because I only see 3 minutes left, I'm just going to wrap it up and see if you all have any questions. Are there any questions at all about charity care? Yes. I don't even know if I was supposed to do Q&A. I've always done it. I always do it at this, so we're going for it.
Quick question. I run into a lot of problems with applying for charity care with for-profit hospitals. Are you guys doing any work on that in terms of advocacy, and or do you have any tips?
Oh, man. So one, because 501R or charity care is for nonprofit hospitals, a lot of times people think, oh, if it's for-profit, I'm out of luck. Not the case. Almost all for-profit hospitals have a charity care process. It's just freaking hard. It's a harder process. And I'm going to look at Erica, who's our lead patient advocate, because what's that hospital, the big for-profit one that's the worst? HCA. I know. HCA, I would say, one, yes, they have charity care programs. we have them on our website, so you can go and see if a patient is eligible, and we have mapped those applications, and we're very familiar with them. So yes, we can help with for-profit. But sometimes, and this is not the right answer because it's the freaking worst, is it just takes way longer. That hospital, HCA, this one is, am I allowed to just name hospitals? Ascension, oh my gosh, and they're nonprofit.
They're just merging with Henry Ford.
Ooh, well, on average, so we've been tracking this. This is another thing that has been kind of fun, is local media will reach out and be like, hey, how's our hospital doing? And then we can kind of like dig into it. And usually it's like, not great. But on average, I believe Ascension will take like 6 months to approve an application, which is wild. In Washington and in Oregon and I think Colorado, like you have to get that turned around in 14 days. Exactly. Yeah, you're getting collections. And so I think if I could give a little advice on it to a patient, it would be they cannot actually impact you for a year because of the new rules that the CFPB put out. They cannot impact your credit for a year, which is what everybody's worried about, right? Hey, this is going to destroy my credit. So like, I know that you're going to get those collections. I know that you're going to get all of the letters in the mail, like we want your money, we want your money. Take a deep breath. You have 1 year. And then if it's not resolved by that time, then it gets a little more confusing because then at that point I'm like, you actually need an advocate to help you figure this out. But I do think that people assume that the timeline is a lot shorter than it is. You have time. Any other questions? Yo.
I want to know what your day job is.
My day job. This is my day job.
I know, but how are you funded?
How are we funded? $4 is 100% funded through philanthropy. It is donations. We offer all of this is free to patients. So who funds us? Like foundations, individuals. There are lovely people out there that give us money and believe in our work. But philanthropy is hard. If you want to talk about philanthropy, oh my gosh, I would love to chat with you about fundraising and all of that. I will say this, and I don't even know how I feel about this yet, but I mentioned that hospitals are, like we're going straight to hospitals saying, hey, let us take this over for you because you suck at it. That is a potential revenue model for us. So hospitals could be paying $4 and funding $4 to do this well. My time is up. Am I allowed to? One more.
Yeah,
One more question.
Yeah, sure, go ahead.
Or maybe 2 more questions. Go for it.
Sorry, this might be a dumb question, but do hospitals deny patients charity care if they qualify based on like poverty, the FPL? Or is it as long as you make under a certain limit, you sort of automatically?
Yeah, they definitely, if they think that you make too much money, they'll deny you.
But is it just based on like the FPL? Like, is it a yes/no decision, or are there other factors that go into it?
So there's a bunch of other factors. Do you have insurance? Are you a resident of the state? There's a whole bunch of other reasons why people get denied. And I think I put in that slide, like the most common are because of the age of the bill that's too old, or I forgot the other one. But income is definitely something that gets people denied as well. But we can usually catch that beforehand because we're screening them and asking them those questions. How much money do you make? What's the size of the household? One more.
I think we do have to wrap up, but if you have any more questions, always find a $4 booth in the exhibit hall, and we can answer that way.
Yes, thank you all so much. You all are wonderful.
Great job, dude. Thank you, Jared.